Hello and welcome. Jean Hales for Women's Health is the national digital gateway for women's health and wellbeing in Australia and the community partner for the International Menopause Society's 2024 Congress. With international experts heading to Australia for the world's biggest conference on menopause, we decided it was a great opportunity to get them to answer questions straight from women in Australia. So here are the top questions that came from you, women from every state and territory in Australia, to be answered by leading clinicians and researchers who specialise in menopause. Let's start with Professor Rod Baber, who was the chair of the scientific committee for the Congress. Jodie in South Australia wants to know, what are the most common symptoms that women in Australia report experiencing during the menopause transition? So from perimenopause right through to postmenopause.
The symptoms that we talk about are the so-called vasomotor symptoms, which means symptoms that can affect blood vessels and blood flow and therefore induce changes in our body. Now, the commonest of those is the hot flush or hot flash if you come from the United States. The twin sister of the hot flush is the night sweat, and both of those are heat-losing mechanisms. So your body's central core body temperature goes up and it does something to get rid of the heat, and that's the flush or the sweat. On top of that, the other major symptoms are poor sleep, muscle and joint aches and pains, and mood changes. So they're the critical ones, and often when people refer to vasomotor symptoms, they're the most common symptoms. And for example, in clinical trials, we know that the most common by far are hot flushes and night sweats in Western societies. And in Eastern societies, perhaps the most common is muscle and joint aches and pains, followed immediately by hot flushes and night sweats.
Thank you, Rod. So with hot flushes and night sweats, the most common symptoms experienced, and we received quite a few questions on managing these symptoms. I'm interested in asking you, Dr. Pramitha Damodaran from Malaysia, for the advice you give your patients on the best way to manage hot flushes and night sweats.
So the best way to manage hot flushes is always to look at lifestyle first. I come from an Asian population where they love eating spicy food at night. And I always tell my women, please stop eating all that spicy food because you're going to be really spiced up at night and have all those hot flushes. So that's really very important. A lot of my women would take a lot of coffee at night, alcohol at night. So I always say, please stop all that. The nighttime is the time to actually sort of unwind and relax because of the fact that you don't want to have those night sweats at night. But many women, even during the day, have got a lot of hot flushes. And I will always say, wear the right clothing, wear thin clothes, thin layers of clothes. Take away the heavy sweaters or the heavy jackets, because that's really very important. It would be great if their workplace is also favorable to them having a little fan next to them, because that would make it much easier for them, or to have tables where there is a lot more ventilation. That would really help. But at the end of the day, what really works for hot flushes is to go on menopausal hormone therapy. And many women who are eligible for MHT, as we call it, would find that it works wonders for their hot flushes.
That's great, Pramitha. Thank you. Now, Professor Rod Baber, let me come back to you for a moment. Pramitha referenced the use of menopausal hormone therapy, which used to be called hormone replacement therapy or HRT, to manage hot flushes. And this was the topic that yielded the most questions by far. And the questions boiled down essentially to this: is menopausal hormone therapy safe?
The word safe has certain connotations, doesn't it? And the obvious one is if it's not safe, it's unsafe. And I think we need to establish the difference between those two issues. First of all, we need to assess each menopausal woman or perimenopausal woman on her own risks and benefits. But if we take all of those into account, then what we know from menopausal hormone therapy is for the average woman who is recently menopausal, which is within 10 years of her last period, then for her with significant menopausal symptoms, the benefits of menopausal hormone therapy are substantial and the risks could only be described as rare.
Thank you, Rod. We have a far more specific question on testosterone therapy. So, Professor Susan Davis, over to you. Renee from Victoria has asked, can testosterone therapy help with brain fog, libido, and other menopause symptoms?
So what we know about testosterone as a therapy is it can be very effective for the treatment of low libido, but presently there is no substantial evidence that it can be effective for symptoms like fatigue, brain fog, and any other conditions or symptoms.
There seem to be a lot of claims being made about testosterone therapy on social media, which might have prompted Renee's question. Where can people go for good information, and how do people know who to trust when they read these conversations online?
There's an enormous amount of controversy about testosterone therapy for women. So in 2019, experts from around the world, without any pharmaceutical company support, got together and discussed what is the true evidence of benefit of testosterone for women and safety. And the consensus was that testosterone can be effective for the treatment of low libido and postmenopausal women, but the evidence is lacking that it will be beneficial for any other symptoms like brain fog or fatigue or muscle weakness, or to prevent any disease like dementia or heart disease. And this is all written down in the document that's available free on the International Menopause Society website.
Now, playing devil's advocate, 2019 was 5 years ago. Are these sorts of consensus statements updated as more evidence comes to light, Sue?
This consensus statement will be updated, but I can assure you, having just gone through the entire literature published since 2019, there is no new evidence that in fact testosterone will be beneficial for anything other than low desire that causes a woman distress.
That's a really important point I think you've just made. Low libido, so a lack of sexual desire, that causes distress. Why do you add that causes distress on the end?
So we know that about 95% of women over the age of 70 have low sexual desire, but it doesn't bother them. Whereas we know that 1 in 3 women at midlife have low sexual desire that indeed bothers them. So when we use the word distress, I'm using the word to describe that it bothers the woman and she would like to do something about it. And in that context, testosterone has been found to be helpful for most, about 60%, but not all women.
Now, questions on the topic of libido naturally lead us to Professor Cheryl Kingsberg in the US. Professor Kingsberg, we have a question from Robin in Tasmania. Robin asks, are there things that a woman can do to help boost her libido before going to talk to her doctor about treatment?
Well, when we think about libido, think about spontaneous appetite, which is, to put it simply, feeling horny, right? It's your spontaneous interest, having appetite. And then there's responsive desire, which is you may not have as much of that appetite that you had, but if you don't overinterpret that, if you don't, if you're not constantly distracted by why don't I, and you can enjoy sort of the process and enjoy responsive desire, that's also a way to kind of shift your mindset about being sexual. For example, women in long-term relationships very rarely have that spontaneous passion at the mere sight of their partner, right? If you've been with somebody for 20, 25 years, it's hard to kind of get that, oh my goodness, I can't wait to get you into bed feeling. Sometimes you can, but on a daily basis, that's a little harder than if you were in a new relationship. So it's really actually the age of the relationship and not the age of the person in the relationship that makes a difference about that, right? If you're 65 and in a new relationship, you're going to have that passion. But if you are 45 and in a long-term relationship, it's a little bit more challenging. So one way is to recognize that, and you have to put your own spontaneity into it, to, change things up a little, be a little bit more playful and innovative and novel, and that can be helpful. Not over-interpreting the fact that, after a long day's work and you've seen your partner every day for 20 years, that's not going to be an easy fix to sensuality. Certainly good health and exercise. We know actually that taking good care of your body with exercise can actually improve arousal, and that can also help with desire.
That's wonderful and practical advice, Cheryl. Thank you. Now to a related question I'd like to put to you, Professor Tim Hillard in the UK. It's a question from someone who wishes to remain anonymous, and it's this. Recently, sex has become very painful. Is that due to menopause, and why would that be?
So painful sex is a common symptom around the menopause, and this is caused by the vaginal tissues becoming much drier. They normally make a lot of secretions, and what happens is after the menopause, those secretions start to dry up, so that makes the vagina more drier and makes it more painful to have sex. That is the commonest cause, and it's usually very easily correctable. You can use lubricants with sex, which you can buy over the counter. Or you can use vaginal moisturizers, or if it's a persistent problem, you may benefit from something like vaginal estrogen, which will help resolve the underlying problem.
Thanks, Tim. I hope that will give people some confidence that there are options available to address this quite common issue. Now, I'd like to shift the conversation to another very common issue, according to the questions sent to Jean Hales: brain fog. Now, Dr. Marita Long, for people who are affected by brain fog at work or at home, what are some of the tips you give your patients to help them stay on task?
I think it's really important to learn to put all your attention onto the task you're doing at that moment. So stay very mindful and very attentive. The second thing I'd suggest is giving into diaries and writing lists and setting up reminders for yourself, because that takes a whole lot of load off your brain and your memory. I also think if you get into that situation where you've got that word on the tip of your tongue and you just can't get it out, rather than getting frustrated or upset, describe what it is you're thinking about, and often that will prompt the word to be retrieved more easily from your brain. And then, of course, it's really important to ensure that you're sleeping well, eating well, and getting exercise. All those things are so important for our brain, our concentration, and our memory.
Ah, yes, sleep. Thanks, Marita. A lot of women struggle with their sleep during menopause, including Jasna in Victoria, going by her question here. Dr. Moira Junger, Jasna is asking, do we know that this really is due to menopause, or is it just something that's happening to women in midlife?
That's a very good question. The sleep problems that happen during menopausal age, not all of it is due to the hormonal changes. So it can be a time of life where there's increased responsibilities, still got dependent children, aging parents, kind of a sandwich time where there's high pressure, high stress, and changes in mood, changes in weight, other things that might be affecting the sleep, and not only the hormonal changes.
Now, Moira, a lot of women who are struggling with sleep then end up struggling with work the next day, according to our questions. Do you have any tips around how to manage day to day when you're a bit low on sleep?
Yeah, when you're low on sleep day to day, and it is dreadful, it's a very debilitating thing. I certainly understand that. I experience it myself sometimes. It's really important to still try to perhaps have a morning walk, even when you think, I cannot even move, I'm absolutely exhausted. Try to lean into that, to be aware of things you're putting into your mouth, like caffeine, alcohol, high calorie, high fat food. Sometimes those things are to be avoided because it actually doesn't help the vicious cycle that we can find ourselves in. So I also encourage people to get very good at micro short napping, like 5-10 minutes here and there if you can, in between meetings, maybe sitting on a park bench at your lunch break, closing your eyes, doing some meditation. Sometimes it might be just enough to get you through another couple of hours, another few hours. Try not to go to bed early the next night. Try to just let your body do what it's meant to do. and have faith in your systems. Your internal body clock will work it out and help you to get back on track with sleep when and if you've had a lot of sleep disturbance.
Thank you, Moira. Continuing to do exercise to help with sleep and mental health is great advice. And in fact, exercise for good health during and beyond menopause is really important. But many women report they have musculoskeletal aches and pains during menopause. So Dr. Sonia Davison, Dawn in Western Australia is wanting information about this topic. Can you explain a bit more about this?
This is a really new, exciting and emerging area. We do know a lot more about this area, but there are research studies that are going on and we need them because this is very important. As we get older, we do lose bone density. We know that with estrogen falling, there is a reduction in bone density because estrogen was helping our bones maintain that thickness. But women will present around the time of perimenopause and menopause, more than 70% actually, with aches and pains. They say, I feel old, I feel stiff, I feel like an old lady. And really this can be because of the drop or the fluctuations in estrogen at perimenopause. So that's the first thing they'll notice, aches and pains. As practitioners, we need to be aware that bone density declines, but an exciting new area is that muscle mass does decline as well. And we lose about 0.6% per year from midlife, which will accumulate. So if we're losing bone mass and we're losing muscle mass and we're not exercising enough and we're not maintaining our diet, our protein, our vitamin D, calcium, etc., you can see that it can really push for in later life becoming frail, not having the mobility, and also being prone to injury and falls, which is a really difficult area.
That's really helpful, Sonia. Thank you. Let's stay with a closely related question on good health. And I'd like to put this question to you, Dr. Esther Davis, from Kate in the Australian Capital Territory. What do I need to do to look after my heart health at menopause?
There's a lot of really easy and basic things that all women can do to look after their heart health as they go through menopause and as they get older. A lot of these are very simple lifestyle things like getting regular physical activity, eating a balanced diet and avoiding too many processed foods. But I think it's also very important that women empower themselves with a knowledge of what their risk of heart disease is. And one of the easiest ways that women can do that is by going to see their general practitioner to get a heart health check. This is a really simple check that involves looking at their blood pressure, their cholesterol, their risk of diabetes. And knowing that allows women to do everything they can to reduce their risk of heart disease in the future.
Thanks, Esther. Those lifestyle tips lead into another question we got a lot. Dr. Priya Sumitran, let me ask you this. Is weight gain simply inevitable at menopause?
No, weight gain isn't inevitable at menopause. It is normal for adults to gradually increase in weight as we get older. And so that doesn't necessarily change much around menopause, but often the place where we store our fat changes after menopause. So we tend to store fat more around the middle.
Dr. Sonia Davison, I want to close by coming back to you for your reflection on how we in Australia are addressing menopause. Do you think the way we talk about menopause has changed? And do we need to change it further?
I've worked in this area for more than 20 years now. I've seen a real, well, it's like the pendulum swinging, isn't it? Menopause used to be a taboo subject. Women did not want to identify as being menopausal, whereas now we will see that the celebrities are openly talking about it, talking about treatments and talking about health, which is fantastic. There's still lots of barriers there. Research is so important, so fundamental. Us having these discussions is really important as well. And talking to women. Women have fueled this discussion by saying, these are the questions that I have. So I think we are much better at discussing things. I think we are much better at talking about this, and the wheel will continue to turn. I hope so.
Indeed. Thank you, Sonia. And thank you to our entire cohort of wonderful experts. And a most special thank you to the more than 100 women from across Australia who provided us with the questions for this all-important discussion. Jean Hales will be releasing more in-depth videos on some of these subjects, so stay tuned and don't forget to check out the wealth of free information on menopause and many other women's health issues at jeanhales.org.au.